the screen now of the logos of all the different seafarers welfare charities in the United States. It's each one is independent, and it's important to know that, because it helps you understand the rollout of these vaccines for seafarers in North America is happening in a very local manner, and it's local seafarers welfare charities that are finding the resources to do it where they are. This previous slide that I already showed was just to frame the work of the general work of during COVID in the last year, doing these gangway only or just to the just on the deck plate, not going into accommodations, doing a lot of personal shopping, and now the key one, helping facilitate COVID vaccines. So when these individual charities are promoting vaccines locally, they're nonetheless doing it in a national and in an international context. To help give a little bit of frame to that context, I've brought up a few of the international movements and also documents that could be of use in the last number of months. One key one is, and NAMA itself has been a signatory to this, was the Neptune Declaration on Seafarer Wellbeing and Crew Change. One of the parts of the Neptune Declaration, which was perhaps less important when it was signed because vaccines still seem to be a long ways away, but now is a huge reality, is that seafarers should have priority access to COVID-19 vaccines. The Neptune Declaration said seafarers should be recognized as key workers by all governments in line with the UN General Assembly resolution adopted 1 December 2020, and the transition of seafarers across borders should be facilitated based on internationally agreed high-quality health protocols. Governments and their stakeholders should work together with the maritime industry to ensure that seafarers, irrespective of their nationality, get priority access to COVID-19 vaccines alongside other key workers and healthcare professionals in recognition of their critical role in global supply chains and trade. That they're key workers, it's not only the crew change crisis that this Neptune Declaration wanted to solve, not just their free movement across borders, but to solve that crew change crisis, vaccines are going to be key, says this Neptune Declaration. Similarly, a few weeks ago, the first part of the fourth meeting of the Special Tripartite Committee of the MLC 2006 met, and it called on all those involved, the members, to make vaccines available for seafarers. I'll read a few lines from this. Calls on members in consultation and cooperation with ship owners and seafarers organizations to carry out a mapping exercise in order to assist with the procurement of adequate supplies of vaccines for the inoculation of seafarers in their country of residence or other appropriate location. Calls upon all relevant UN bodies to recognize the need for a collective approach to secure the number of vaccines identified as being required by the mapping exercise. Calls upon governments in accordance with their national vaccine programs to make supplies of WHO emergency use list vaccines available for seafarers on ships visiting their ports and their territories in order to facilitate necessary crew changes and minimize disruption to global supply chains. Importantly, that vaccines are not just available for the people, seafarers from your country, but also for visiting seafarers. Finally, a more recent document, this from the IMO, the Maritime Safety Committee of the IMO recommended that member states and relevant national authorities to prioritize their seafarers as far as practicable in their national COVID-19 vaccination programs, noting the advice of the WHO SAGE roadmap for prioritizing the use of COVID-19 vaccines in the context of limited supply published in November 2020. Proper consideration of extending COVID-19 vaccines to seafarers of other nationalities is also recommended, taking into account their national vaccines supply. So from these important international groups, extending vaccines not just to your local, your national seafarers, but also internationally was something that the Neptune Declaration, the ILO, and the IMO have all said. And these are all important documents. As was mentioned, even NAMA is a signatory to the Neptune Declaration. So in order to facilitate this work, I've been invited, and a number of different people in our networks have been involved in various work groups, especially under the International Chamber of Shipping. They're the representatives of ship owners around the world. And the International Chamber of Shipping has had, with its labor colleagues and with lots of its members, a number of different phone calls for the whole COVID crisis. But for the last number of weeks, I've been involved in a vaccine maritime work group to solve some of the common problems to overcome for vaccines for seafarers. Out of that work group, at least 3 documents have been produced of relevance to the conversation we're having today. Coronavirus legal liability and insurance issues document. This is one that I would invite you to read. There's lots of really interesting legal considerations in that document. It's written from a UK perspective, one might say, but I think it's still very relevant to a lot of the questions about liability, who pays for what, and how things should be done with best practice from the maritime industry point of view. A second document that was produced at the same time was a COVID-19 vaccination for seafarers and shipping companies practical guide. And this practical guide was especially for seafarers themselves. And we received, and I'll show you a picture on the next slide, we received from the ITF Seafarers Trust some money to print this document and hand it out. I'm very happy to say we've done so in about 30,000 copies at this time to seafarers around the world. If your Seafarer Center would still like to have some copies, I do have some available, and I can provide some funding to make some copies available of that. More recently now is a more technical document that's a roadmap for vaccination of international seafarers. Again, it gives especially governments, shipping companies, an idea of how this vaccines could be rolled out around the world. Especially it pushes for the idea of hub ports in key countries around the world to reach the maximum number of seafarers in a minimum amount of time. The rollout in the United States has been quicker than this hub port idea. We've been able to push things out, I think, quite a bit quicker than hub ports. But hub ports, I think, will still be very important in other countries. At the same time, one of the flag states, the Dutch government, has promised that any seafarers, both Dutch, but also any foreign nationals on board Dutch flag ships, will get vaccinated. And there's a few other initiatives like that in certain countries that are to be that can be, I think, models for other countries. As mentioned, we printed this practical guide in many different countries. And again, if you would like to have a little bit of funding to print it in your local setting, we want to avoid shipping this from centralized locations and would much rather just fund the individual seafarer centers to print it. We do still have funding for that, and we do have a few copies available as well. These are some great pictures that Father Paulo Prigol sent me from a distribution in the Philippines, where they've done more than 10,000 copies for seafarers in the various different seafarer hotels and other residences. So coming to the United States, how did this sort of develop in the United States so quickly? Well, one of the key things, the key drivers of vaccines being available was vaccine availability. There was enough supply for local populations, but then also for others. And one of the key groups that really pushed this was the cruise industry. In order for cruise shipping to restart, vaccines were part of the roadmap from the CDC and were really being pushed. And in order to do that, they needed help from at least one of the states. And the state that really picked it up was Florida. And so on April the 29th, Florida made an official pronouncement that public health advisory that said that the public health advisory also expands vaccine access and eligibility to any individual in Florida who is present in Florida for the purpose of providing goods or services for the benefit of residents and visitors of the state. This opened the door. This was especially for cruise ship workers, and it opened the door for a number of cruise ship companies to do mass vaccination of its workers. And that is still going on full steam in Florida in a number of ports. Here is Michael Bailey of Royal Caribbean, I believe, who just posted yesterday on Facebook that 200 plus Serenade of the Seas crew received their vaccine today in Port Miami. That was just recently. And so there are these large groups of seafarers who are getting, I think it's typically double shot Pfizer, if I'm not mistaken, but others can correct me. So the ships come in and they try to do large groups, large batches of seafarers. So in this one circumstance in Florida, the idea was that any of these seafarers who are coming to serve the Florida economy, cruise ship workers, among others, could get access to the vaccine. But it also opened the door to then cargo ship workers getting vaccines as well. And so a number of other ports in Florida between a few weeks ago and until June the 25th are making vaccines available in a concentrated push. But then there's another way that, a second way that seafarers got access to vaccine in many different contexts. It's the question of ID, that in many states in the United States, either no ID was required, as in Galveston, for example. Here's an announcement for a next vaccine clinic, or any ID is available. And that's true of perhaps many of you listening on this call, where your local pharmacies are welcoming anyone who might be physically in the area can get a vaccine. I know I'm from Canada. Many tourists into the United States from Canada were also allowed to get vaccines as well. And so whether it's in Florida, where it's officially pushed, or whether it's because no ID or any ID is required, many seafarer centers in the last few weeks have started to push out vaccines. So vaccines are happening on board in certain locations, are happening in seafarer centers in certain locations. We just saw on the last slide the Galveston Seafarer Center, where there's a clinic that has been set up, or also in probably the majority of cases right now, the Seafarer Center facilitates transport in small groups from the ship to a local pharmacy or other healthcare provider. I'm trying to follow as many as I can on Facebook, and here I'm promoting NAMA's Facebook, but really it's a roundabout way of promoting all of your news feeds. You can go to facebook.com Maritime Ministry, which is NAMA's Facebook feed, and just scroll through the last few weeks. I think it's really joyful to just see all these different initiatives happening in ports around the United States, here at Global in New Orleans, and the Seamen's Center of Wilmington, and Baltimore International Seafarer Center, Point Comfort, Seamen's Church Institute of Philadelphia, Port Tampa Bay. There's all sorts of other ones from others of you listening on this call, doing it in various different ways. So this is just that many of all these independent seafarer centers are doing work. They're figuring out how to do it in their local context. Seafarers have certainly started to pay attention. I've received lots of different calls from different seafarers and emails from seafarers themselves over the last number of weeks, but also shipping companies. Shipping companies are keenly interested in general to get their crews vaccinated. And for them, it's a business decision. It's much better to spend a little bit of money and time to get the crews vaccinated than have to deal with a COVID outbreak on board. And I've had different ship owners and operators tell me that they would be happy to spend the extra time to get seafarers vaccinated. Maersk noted on its social media feed that it's trying to do a program in the United States to get seafarers vaccinated. Workgroup and then OSM Maritime, all of them these are just a few examples out of many other ones that different ship owners and operators that are trying to get crew vaccinated. Interestingly, some of these are not, they sort of announce them as programs, but what they're just doing is working through seafarer centers or working through local pharmacies with their agents. It's not necessarily an organized program. It's more just they're taking advantage of resources that are available in the various ports. This has been a hot topic in maritime press in the last few weeks. Here are a few examples from Maritime Executive, from AJOT, from Tradewinds, from the Nautilus Telegraph, from Lloyd's List, and a number of other publications. This is something that is of keenly of interest in the maritime world right now. In order to help share information, NAMA created a couple of weeks ago a list on our website. You've hopefully seen it, nama.org/vaccines, where we're listing all of your information. I am really looking forward to getting more clarity from you. If your program has changed in any way or you have additional information, please share that with me. I like to keep this up to date. And of note, there are a lot of seafarers and shipping companies who are looking regularly at this list. I'm very happy to keep it up. If some other agency, the Coast Guard or some other agency, wants to take over this work and is better at keeping up this list, I'm happy to pass it on to someone else. But for the meantime, NAMA is keeping up this list. What are some of the next steps? Well, at this point, and indeed that's what we're doing right now, is sharing some best practice. What kind of best practices are we learning? What are the common frustrations? What are some of the good ideas for overcoming those frustrations? I want to hear from you, and in just a few moments, I'm going to open up the lines, and hopefully you can tell us your story about how vaccines are working in your local context, or whether there's roadblocks in front of you. Secondly, I'm convening a small informal sharing group with that has a few NAMA members, including we have our president, Deacon Paul Rosenblum. We have a representative of the Center for Maritime Advocacy of the Seamen's Church Institute, Phil Schifflin. We have representatives of ITF, the United States Coast Guard, the Department of Transportation, the Chamber of Shipping of America, and a few other representatives on that call. It's meant to be a small enough group that we can share information about this without making it more than what it is. The key is just to be a sort of a clearinghouse of information so that our seafarer centers can get information they need, and the industry and others can get information. I'll just mention one of the kind of one piece of information. A key stumbling block in most places is that seafarers can't get shore leave. They can't necessarily have the right shore passes to go ashore because of different reasons. And so we've already written to Customs and Border Protection to see if there can be any kind of flexibility on those shore passes. And we're hoping at our next meeting this week, perhaps even to have a representatives of CBP on that call to see if we can overcome that key problem. Last week, I did a needs assessment. If you haven't filled it out, it's a little survey monkey for your organization. To get a sense of how many vaccines have been given, but also the ITF Seafarers Trust, the funding group, and a few other funders would really like to fund the seafarers welfare charities in doing this work. And so I'm getting a sense of the scale of any costs involved in this, whether there's costs for mileage or personnel to do this better. 21 groups have completed this. I note that we're about 40 locations doing it, so I'm hopefully going to get another 10 or 15 responses to this needs assessment. But of those 21 that have completed, you might like to know that we reported something like 1,800 vaccines have been given in the last 7 to 10 days, or 7 to 14 days, give or take, since these programs have begun. But of note, there's certain programs that have only just begun, and some that aren't even beginning until tomorrow or the next day. But of the same group of 21 has reported that they guesstimate that in about a week's time, they will have completed another 2,140 vaccines. Again, this can happen on board in the Seafarer Center, or bringing them to the seafarers, bringing them to a vaccine clinic. I find that this to be tremendously enjoyable to see these numbers, that perhaps within a week or two, there's already via your very hard work, about 5,000 perhaps seafarers within 7 to 10 days or so. Perhaps we can say 5,000 seafarers will be vaccinated. I do note, however, I do know also that there are shipping companies that are doing it by themselves. They're just connecting with a local pharmacy and with their shipping agent, bringing the seafarers themselves. So there are probably another many hundred, perhaps thousand, who are being facilitated by agents. And then after there are commercial opportunities. There are, and we've all heard them, certain ones that are reasonable, some that seem to be unreasonable, but again, I don't have more information. Certain companies that are facilitating the vaccine, all of them say the vaccine itself is free, but then they have some kind of administrative cost on that, whether it's a cost for transportation or a cost for other administration. And we've heard numbers between 100, 200, 300, 400, 500. 3 or 4 weeks ago, we heard more than that, but it would seem that those really high numbers have now been pushed out of the market, and really it's in the single digit hundreds now per person, that those administrative fees, the cost of the administrative fee. And that's a reality that a number of shipping companies know that those numbers are high, but are happy to pay those numbers because they're just desperate to get vaccines. The last thing I'll say, and I'd love it now if anyone would like to speak about their experience of having given the vaccine. I'd love it if you want to raise your hand. I can recognize you and open your microphone. The last thing I was going to say is that one of the other key things is that just the kind of vaccine, whether it's the Johnson & Johnson vaccine or Pfizer, Moderna. In almost all cases, seafarers definitely prefer the Johnson & Johnson one-shot vaccine, but it simply is not available everywhere. There's not necessarily a big stock of it, or in certain places they're just out of it for the certain time being. So there are certain seafarer centers where all they can facilitate is Pfizer, for example. They can only facilitate the first shot of that, and it's the seafarers can choose that if they wish. So I'd like to open the microphone, and I'd like to hear from you. So if you would like to tell us your experience or your questions or your comments, now's the time. So first, Helene Pearson from Philadelphia. Hello, Helene. You can either open your microphone or also, I think, your video, and you can join us. You have to unmute yourself. Hello, Helene. How are you?
Can you hear me?
Yes, I can.
Okay. I'll pass on the photo. I just wanted to follow up and ask you, actually, on your efforts with customs. Are you including the 29-day rule? Because I do right now have seafarers that got Pfizer and Moderna. Their second shot time is coming up. Mostly we've done Johnson & Johnson, but we did do some Pfizer and Moderna, and they knew what they were doing at the time, but now they are being cut off because of the 29-day rule. So I'm offshore only at this point, and don't have a mechanism to get there. So I'm just wondering if you are including that. And then I just wanted to say that compared to the usual with customs, our local customs was very friendly about this topic, because we have just in this area, because of a seafarer that disappeared in the last couple of months, Myanmar seafarers were all restricted from going ashore here. And within an hour of a ship arriving, where we were vaccinating almost the entire Maersk ship, and ran across that issue, customs actually lifted that. So that was very hopeful and promising, and different from the past, so they get it.
For the benefit of the others that are listening, could you tell us what organization you're with, where you're at? Then also, what's been the size and scope of your efforts so far, as far
Sure.
as vaccines, I
So
mean?
I'm from Seaman's Church of Philadelphia and South Jersey. We serve the Delaware River 28 terminals in the Philadelphia area. And we've been doing about 20 vaccinations on average a day for the past couple of weeks. So today we'll be at about 225 total. We do not have onboard capability yet, and we are taking those with shore passes to local pharmacies to get their vaccinations. And although pros and cons to everything, the con of leaving behind those that don't have shore passes is definitely something we want to solve. But we are absolutely loving getting seafarers that never get off the ship, even during COVID, even though they have shore passes, onto land for the first time, and they're enjoying that too, and to the drugstore and stocking up on snacks at the same time.
In your context, have you ever had any, when you're coming back to the terminals and seafarers have bags full of crisps or chips or whatever from the pharmacy, has it ever been a challenge when you come back that the gate guard said, "Hey, what are you doing? You know what, you were supposed to go just for the vaccine, you weren't supposed to go shopping as well"? Has that ever been a question?
The only one we had was that the very first Myanmar ship, where again, they were lifting just for the purpose of vaccine, the local restrictions. And I said to my driver, "You can let them get snacks." And he said, "Oh no, the agent said we can't." So it was only in that case. That's the only problem I've had.
And do you think that same agent would still have that objection, or is it...
I think it was I think, in that first hour that morning, he didn't think there was any way customs was going to bend. He was so surprised they were. They probably like kind of laid down the law to him, and that was kind of that.
Thank you. Well, thank you, Helene, for giving us this update. It's really good to hear about the efforts of the Seamen's Church Institute in Philadelphia, South Jersey. Thank you for also just letting us know on the 225 number. That's really, really fantastic. And no, the 29-day rule was not on my radar screen, but yes, it is now on my radar screen,
Great.
And I'll raise it at the next meeting. It definitely will be on my list of things to bring up.
Thank you.
Thank you so much, Helene, for telling us about Philadelphia. Anyone else now would, if you'd like to raise your hand, and I can recognize you, or else I would love I see some number of very good names of people I'd like to hear from. Manoj Joy from India. Go ahead, Manoj.
Hi, Jason. Can you hear me?
Yes, I can.
Yeah. Good evening, and good evening to all this team participant here. Well, here I'd like to share that we are trying to get the vaccination for the seafarers in 2 ports. One is in Chennai, and other in Mangalore, with the hospitals we are tied up, the Sailor Society. And we hope that by the next week, the hospitals are expecting the vaccines. Apart from that, as far as Chennai is concerned, the Sailor Society, we have our own ambulance and a tie-up with one of the finest hospital for the retired seafarers. Now, we are providing this ambulance because here the shortage of hospitals, shortage of beds with oxygen, and getting ambulance too has become difficult. So the Sailor Society ambulance will be available for all the seafarers and the family members, in case they find difficulty in getting the ambulance, all that they need to call is the hospital, or they can give a call to me, and we'll ensure that the hospital is sent to them free of charges. Nothing will be charged from the seafarers. So we are on standby. Some of the seafarers are getting their monthly medicines, etc., free from the hospital. And we are trying to see if elsewhere also, if we can provide the vaccination for seafarers.
When you do get the vaccine, how is there any sense of how many vaccines you'll be getting if you do get an allocation?
No, they see now, for example, in the Chennai port, the DG Shipping, through their efforts and the government of India's efforts, they are providing vaccine for the seafarers. But one issue is you must have at least 10. Once you open a wheel, it has to be vaccinated for 10 people. So, for example, there are 25 people, and they opened only 2 whales where 20 people can be administered. So the other 5 they don't get, otherwise there'll be wastage. Whereas what we are trying to do is in Chennai with our tie-up hospital, there is no issue of 10 people, 15 people, any number. Like today there are only 2 people, or there are only 2 seafarers. They can go and get, because the local population too is getting the vaccine. So what we are doing here is we are giving priority to the seafarer. Maybe there are 100 people waiting or 200 people waiting for the vaccine. So we have the arrangement with the hospital. The seafarers, they walk in street, they have their vaccine immediately. Maybe they wait for 5 minutes or so, and they can leave. They don't wait with the crowd, the 20, 200 people, 300 people, they don't crowd there. So the name is sent well in advance. But whereas if you're going to the port hospital, minimum 10 number should be there, minimum 10 number. So that becomes a little tricky sometimes. So here, even if it's 1 number, we have no.
Hello.
Yeah. Just,
yeah. Sorry, I think we lost you.
So if it is 1 number, even if it's 1 person is there, we have no issue. We can provide them with the vaccine. So that is the advantage, we are looking at.
Thank you so much, Manoj, for that update. Out of the Stella Maris International, Father Bruno, go ahead.
Yes, do you hear me?
Yes.
Good afternoon to everybody. It's very nice to hear that United States, you are vaccinating all the seafarers. I think Europe is very well behind, especially talking about also Italy. One of the issue I think that we have, at least in Italy, is we don't have enough vaccine for the local people. And so that's one of the issues, I think, why they don't provide vaccination for seafarers coming to the port in Italy. Just the other day, they've opened up the vaccination to the Italian seafarers, and they started doing it in the different region where they come from. So I think that could be one of the reasons why in Italy, and maybe also in other parts of Europe, the vaccination of the seafarers is not started yet because of the lack of vaccine. Just early this morning, I talked with Father Paolo in Manila, and what he reported to me is that vaccination in Manila is not yet started for the seafarers, and means that is a big issue, because we know that at least 1/3 of the workforce in the maritime industry is coming from the Philippines. Seems that the government doesn't have funds to buy a vaccine, and so is asking private to buy it, and if they buy the quantity, half of it has to be given to the government, so that the government will vaccinate the normal people. That's all.
Thank you very much, Father Bruno, for this international perspective. I am so thankful on this call to have, we've got a number of different nations represented, and so hearing from you all would be great. Turning back to some of the those from United States, I'm wondering if anyone from either the ports of Newark or Charleston or Houston, some of the large ports, might tell us a bit about what are the common concerns or common questions that that you have. So I'll go first to, I think, Timothy Wong, if I can find where he is. I just saw him and now he, there we go. Timothy, would you still like to speak? I think I saw your hand. If you want to put your hand up again. There we go. And Timothy, Tim,
Hi, can you
go ahead. Can you tell us a bit
Okay.
about the your work in Port Newark?
Yeah, so we have two options here. One of them is, like many of the Seafarers centers, we've been transporting seafarers to the local pharmacy. And for us, the closest one that has the Johnson & Johnson vaccine is the ShopRite in Hillside. We've been doing that, and we've been offering that option as the first option. The second option that we were able to offer is there's a doctor who has a clinic locally, and they've been working with this doctor, Port Authority has, to provide a medical need for the local port workers and all. And he provides this service where he can go on board to vaccinate the crew, but he charges $2,000. And then in turn, the agent charges $4,000 for that service to the captains and the shipping companies. And so we do offer that option. And more so than not, the captains decide to go with that option because they would like to get all of the crew vaccinated versus us only able to take the crew members that have the C1D1 visa. So because of that, we haven't, I guess our numbers aren't as high as we thought it was going to be transporting the seafarers to the to ShopRite to get the vaccination. But I guess the most important thing is to get the seafarers vaccinated. And I just want to speak to your point before earlier when you asked about whether or not we come across issues where the security was very strict about the seafarers not shopping when they're out getting the vaccine. Ran into that yesterday, and it's especially tight when we are picking up seafarers from tanker terminals here in Carteret and in Perth Amboy. So they're very, very strict about that. And the other issue is the transportation that the internal terminals provide to get them out of the to get them off the vessel and through security. It seems that they don't put a high priority on that. When we set a time to meet, and it's they kind of get to it when they can, and that wastes a lot of time for our drivers or our chaplains to try to transport them to get their vaccine, and they're only allowing five out of the to go past security at a time. So even though the captain promised 11 people at a time, we're only getting 5 at a time. So we have to take multiple trips to the pharmacy to get them vaccinated, which is not the most efficient way of doing it. So that's actually one challenge that we're running into. I don't know if you can address that or help address that because these tanker terminals are really causing us a lot of issues in terms of that.
Is the 5 at a time a function of the port security, or I've heard also it's a function of the number of doses you can get out of a vial at the pharmacy doesn't want to open.
No. The pharmacies are ready to help us. I've been fortunate to work with two very good head pharmacists at ShopRite over in Hillside, and they're ready. We tell them, do you have 22? They said yes, bring them on over. They're ready to take them. It's not the issue with the pharmacy.
Okay.
It's the issue with the security not allowing more than 5 out at a time at the tanker terminals.
And then the commercial option that you talked about.
Yeah.
When you bring this doctor on board, or if is that something that's possible? Is that $4,000 fee from the agent then waived?
No. So actually, it's not been us bringing the doctor on board. The transportation and the clearance to get through security and all that, that's handled by the agent so far when we found out about it. But, when we found out, I spoke to the doctor and he says that the agent arranges everything, you know, the transportation, the billing, the clearance to get onto the vessel and all of that. So we haven't actually had to do any of that. But I'm actually looking into a local medical group that has a COVID center, you know, since they have access to all the vaccines, to see if they can also provide this service and replicate, you know, what Dana Bloom is basically doing in Houston, and hopefully at a lower cost as well, because, you know, we've had some pushback from different companies saying that, oh, well, you know, if you look on CDC that, you know, they're not supposed to be charging or taking advantage of this. While they understand that, you know, there is a fee that comes with administrative costs and, you know, the cost of paying the personnel to be on board, it shouldn't be at, you know, maybe that high of a cost. So I'm trying to see if we can, you know, get other organizations that have access to vaccines and personnel involved in this and replicate that service, because I think Dana Bloom is doing a wonderful thing down in Houston, and we hope that, you know, all the other seafarer centers can replicate that as well to get, you know, as many seafarers vaccinated as possible.
Thanks. And just as clarification, so the numbers you said was the doctor costs $2,000, but then
Right.
$4,000 is the agent's facilitation of this.
Right. So basically, the agent is charging the shipping companies or the captain $4,000 for the service, when the doctor is only charging $2,000 for the service.
Oh, sorry. Those are two separate things, is what you're saying.
Correct. So,
okay.
so
Sorry,
like,
sorry. That's what I didn't
so
understand.
I would approach the doctor and say, hey, can you go on board this vessel and vaccinate the crew? It will only cost $2,000. That's what he charges. But if a shipping company or the captains went through the agents or their agents, and they go through the same person, they're charging them $4,000. The agent is.
Okay. So there's another $2,000 basically on top.
Correct. Yeah.
Yeah. Okay.
Yeah.
Thank you for clarifying that. Well, you've asked a question of Dana, and she's the next one on the list. So I'll open up. Thank you so much, Timothy, for telling us about Port Newark. That's very instructive. Next, I'll go to Dana in Houston. Dana, how are you?
I'm good, Jason. Can you hear me?
I can. Tell us about Port Houston.
So in Houston, we jumped on this bandwagon right after Corpus started doing it. And we reached out originally to our city and our county to see if they would help us. And while they worked through some red tape and pushed it back and forth, the state health department jumped in for us and said, we'll come in and we'll provide Johnson & Johnson vaccines. We'll do it as a demonstration project, like a proof of concept. And so that started our journey on vaccinating. And they gave me 3 days the first week that they were here. I was hoping it would be 5. And but they would get the J&J vaccines as an emergency dose or quantity. And we would head out to ships, and we would do about 3 or 4 ships a day. So right at 100 seafarers a day, just a little under. And then they pulled back because, being the state health department, they also had to help others. So the prison system, and step in at different times and help other groups that they already had commitments to. So I sort of lost them. And then we started getting some weather. And I'm telling you all this because this is how I ended up where I was. On a day that was beautiful and sunny, the state said, we can't come because it's rainy. And I'm like, are you kidding? And I thought, you got to get what you pay for. All of this was free. We were offering it to the seafarers for free. We weren't charging anything for our transportation or anything like that. And so I got on the phone with my board president, and he had been speaking with a gentleman, Robert Hahn at WGMA, who WGMA uses a clinic in their building to do COVID testing and drug testing and things like that. And he said, you know, this gal in here, it's kind of slow, but she might be able to do it. We started talking to her, and that very day, we worked with the city to get her an emergency supply of J&J vaccines, and she went out on the vessels, even though it wasn't raining, but it was supposed to be raining. She vaccinated until midnight that night. And we were off and running. And she has a mentality that she knows that the vaccines are free. She's only asking to have her costs covered. So she charges $150 an hour with a minimum of 3 hours. So the majority of the vessels here are being vaccinated, their entire crew, whether it's 10 or 11 seafarers or 25 seafarers, for $450. We assist with her escort, getting her into terminals, but we've also started putting some of that back onto the agent, because they have to ultimately be responsible for the gate list. And so we push them to make sure the gate list is there. if they need specific transportation, because we have a lot of petrochemical terminals and every one of them are different and different to maneuver. A chaplain can get in, but he might not be able to escort her crew. Her crew is very small, which I like. It's a one nurse and one tech usually, where the state, we walked around with 7 or 8 people, which meant I lost a chaplain and a driver just to escort them around. But the private entity, now what happens is everyone comes to me. I explain what's going on because she doesn't have the time to go through every little detail like that. And then if they want to move on with being able to pay, which 99% of them do, then we copy her and she moves on and she schedules, she vaccinates, and she does all the documentation, because it is also important that the seafarer not only get the card, they have to get their certificate, because that card may not let them back into their country. So they're getting a bigger certificate, that's something like you and I would get if we went to our state departments for a vaccine thing. So we're working really closely. She's a little overwhelmed, and I'm in the middle of planning a gala right now. And I've assured her as soon as that stops, I'll be able to have more people to help her. But she's doing a great job. Her philosophy is to try and not say no to anyone. The agents are all learning, and so they're now just copying me, but going straight to her, which is wonderful. She will also travel to Freeport, Galveston, and Texas City, but the travel time means they'll pay more because it'll be extra hours to do that. And so far, the people that really need it haven't worried about it. And yesterday, for the first time, she went offshore. One of her nurses went with an agent and they flew in a helicopter offshore to a vessel. So, and that's about to start. I've already had 2 more phone calls about, can you vaccinate the crew while they're offshore? Because we have at least 50 vessels every day anchored offshore. Maybe all of you do. And so we could start hitting them before they even come into our port. I don't know right off the top of my head how many seafarers we've vaccinated, because she's moving so quick and we're moving so quick. We've got a database, but it's in the thousands. And so again, our center, my board would like us to try and charge a little for some of our services. I look at it as really, it's just administrative, a lot of emails and calls right now. Every once in a while, a run here or there. I like the goodwill better than a few dollars, to be quite honest with you. I think it's going to go a lot further for us in the long run, since our tariff is voluntary and things like that. I'm hoping people at some point will remember that we helped them do this. But it's been kind of fun. It's been, kind of hectic as well. I'm very glad I'm no longer the person, because for the first 2 weeks, I did all the scheduling, I did all the talking, and it was from 3 a.m. until midnight. And so it was insane. But now I don't have to do that. So I'm excited about that. And we're adapting. Also, I have one seafarer that's coming in. He needs his second Moderna shot. And he has 2 seafarers who need their Johnson & Johnson, and all 3 of them luckily can get off the vessel. So we'll pick them up and we'll take her to her brick and mortar clinic. She has just this little clinic office set up, because she also does have the Moderna vaccine there. The state would not do it, which you've already heard, because once you open the vial, it has 4 or 5 vaccines in it, and they didn't want to waste a whole vial just to do one vaccine. And we all understood that, but she is able to do that because she gives them a Moderna vaccine also to like the WGMA guys and stuff like that. So it's working out really good. I feel very blessed and fortunate that I've got this partnership. I do know that how we found her, which Tim kind of alluded to, she was already out there doing COVID testing and drug testing. So some of her staff, her nurses and techs, already had the TWIC cards. So I'd encourage you, this is nothing that only Houston does in their ports. So look for those opportunities or those little companies that are out there. She's a one-woman owned entity that staffs up and staffs down. She can have up to 90 people under her payroll or less. And so she's staffed up right now to help us, but look for those entities. We've actually found one more entity that can also probably get geared up to do this. In Houston, we've got enough work to keep several of these groups very busy. But so I'm hoping that maybe the next time we have the call, or a couple of calls later, I might be able to tell you we've got 2 groups out there doing this. But this group is really taking it and run with it, and I appreciate their partnership. So,
Well, there was a tremendous amount in your in what you just presented, Dana, which could be of interest. I know we're reaching time right now. I just wanted to know if one last port, if Charleston, we have 2 brief minutes, if either Clark or Deacon Paul in Charleston would like to describe just briefly what they're doing. Deacon Paul, go ahead. Can you briefly describe what you're doing in Charleston?
Happy to, Jason. We have set up a partnership here with the Medical University of South Carolina through one of my parishioners at St. Mary's. We have a trial run set up, I believe, to start June 1st or so over at the Wando terminal, which is our busier terminal. And we hope that that will extend to the North Charleston terminal and other terminals around. It is a trial run. We'll be working out some kinks, I'm sure, but I think it's going to be a very successful program. It points out, and I think this is true for everybody, and it's been said by others, that a lot of this is beyond the ability of the local seafarer centers to do. We really need to be in partnerships with universities, health departments, et cetera. That's where, and we probably even need cooperation from higher authorities in state and federal governments to really do this properly. But we're making good progress here, and it's wonderful to hear about all the good progress around the country.
Thank you very much, Deacon Paul, for telling us briefly about Charleston. We're right up against time. I know there's more that I would like to hear from on this call from different ports around the United States. Please do contact me. I really both enjoy hearing about your programs, but need to know about what the key challenges are that we can work through. We've heard a few of them already today. Some of the things that people are working on is this 29-day rule and shore passes, whether seafarers can go shopping while they're getting their vaccine. That seems to be a sticking point in 2 or 3 different places. We've heard about some international efforts and keeping that in mind about different countries that are thinking about this. So we've heard of in India, in the Philippines, we've heard in Italy, and also I know there's a few on this call from Canada as well. We have heard about the question of costs of all this, how to pay for it all, and whether or not we should be helping facilitate paid people, different groups that are charging a certain amount of money. All of those, there's not necessarily clear answers to all these questions, and so working these things out with each other is, I think, very useful. Well, thank you everyone for being on this call. I hope you have a great day. Please stay in touch with each other. And I really appreciate that all of you are so keenly interested, and so many of you are working so hard to provide vaccines for seafarers. Thank you so much, and I hope you have a wonderful day. Thank you.